Oh, timer.
Alright, so when you have pain, what do? You go to the doctor and you tell them, Doctor, I have a pain here, there, or whatever's going on. But what about for vets, animal doctors? They can't talk to their patients and be like, hey, what's going on? And so that's what my informative speech will be about. I'll be telling you guys about how, the difficulties of vets, assessing pain in animals in their patients, how they do it, and really still like the difficulties they still may face. So it can be done, assessing pain in animals, but it's a very complex task. So I'll be telling you about the difficulties of assessing pain in animals, the methods that they use, and how further context may like shape their diagnosis. Okay, so first I'll be talking about why assessing pain in animals is difficult. There's several reasons. As first, like I said, animals can't really communicate how they feel. Not at least not like how humans can. You can tell your doctor how you're feeling, but a dog can't do the same. So according to today's Vet Practice March 2012 article, Pain Assessment in Dogs and Cats by Arusha Balakrishnan and Elena Benasuti. Typically, vets rely on owners, their word, like, hey, my dog is acting like this or is feeling that. But the thing is, owners aren't usually vets. So, the doctors are kind of just going off the word of somebody who isn't really trained for this. So, yeah. Another issue is that animals typically like to hide their pain, especially like prey animals like birds or like mice, rabbits, because in the wild, if you're in pain and you show that, you're pretty much broadcasting to predators, hey, I'm an easy meal. So typically they'll try to hide that, and that can make that hard for vets to, figure out what's going on because it's in their nature to try to hide it. So I explained why some of the difficulties that vets have in assessing pain, but now I'll talk about some of the methods that they use. So there's two typical methods that they use. They look at their behavior and they also look at their physiology, like their physical attributes, kind of like what's going on. Behavioral, like even though like a lot of animals try to hide their pain, they'll still show off behaviors, and these are like patterns that vets use to recognize what may be going on. For example, the North Carolina State University, in their article, Pain Assessment Tools, they explain something called the Feline Grimace Scale, which is pretty much like a behavioral kind of like tool that they use to assess pain in cats. Kind of like looking at their face, it's like even just the most like minuscule like changes in like their eyes or like their mouth, how their tail moves or whatever. And that can tell a vet like a lot about what's going on with the cat. And these types of scales exist for other animals as well, like all types of like dogs and critters and all that. Another tool that they use, or like another way they try to assess like pain, is physiological. So in the Merck's Veterinary Manual of March 2023, Recognition of Pain and Assessment in Animals, they explain some like the physiological things that they look at, like heart rate, respiratory rate, hormones, overall like things like that. But even though there are ways to assess pain in animals, trying to figure out what's going on, there's still difficulties, made by further context and all this. So one of the reasons that it's still difficult to assess pain in animals is because even though there are like models and tools and scales to use and all that, there's not really a consistent way of using that. In Frontiers December 2023 article titled Attitudes to Acute Pain and the Use of Pain Assessment Scales Among Spanish Small Animal Vets, they found that only 44% of surveyed vets, of about like 244, only 44% of them actually use like pain scales. And the pain scales that they use aren't always like, I guess like in line with each other, consistent with each other, yeah. So if they're not really being consistent with what they're using, a different vet might come up with a different diagnosis for what's going on, or if they even use like any of these tools to begin with. Another thing that further complicates things is medical history. If say you have like a little puppy, first time going to the vet, obviously what's going on with him is going to be much different than an older dog who's been to the vet many times. Even if it's the same thing, like a broken leg or something, the older dog might have, say, like past surgery there, or some kind of like genetic defect or something. So medical history can also like further complicate things. No two animals are the same, and that can just create a whole mess. Still, even though all these complications, there's still ways to understand how pain is, for vets to understand pain in animals. Like I said, even it's complicated because lots of them try to hide it, and animals can't really communicate it. But there's still ways for them to do it, even if there are further complications with those ways. But at the end of the day, vets, they do their job. They're the voice for the creatures that don't have a voice, essentially. Thank you.